Good afternoon, ladies and gentlemen, and welcome to the ninth episode of the Wired for Success podcast, the first of 2025. It just feels good to be back. We've got a special two-part episode for you today, where we're going to be announcing a very special event and campaign that we'll be running. As you can see to my right, I got two special gentlemen with similar names. The man himself, Paul James, our managing director.
Thanks, Manny.
And our very own special guest, Ben James from the Anthony Seddon Fund. How you doing?
I'm good, thank you. Thanks for inviting me along. Excited.
Pleasure is ours. So the good icebreaker question I like to ask everyone, just to get you a bit more comfortable. Is this your first podcast?
Pretty much, yeah. I did a podcast, but it was over Zoom, so I don't think it counts as a podcast, does it? So, this is the first time I've had the mics and lights and
the lights.
Yeah,
Got the Manny treatment.
Yeah,
and the big lights glaring off me bald head. Yeah, but yeah, no, feels good. It's nice.
Excellent. Yeah, we're happy to have you.
Thank you. Thanks for having me.
People might be wondering why you're on. Of course, we're always our special guests, and we work a lot with charities, so it ties hand in hand with why you're here. But from what we will be announcing today is something very special that we'll be running this summer. Further ado, I just want to let the audience know a bit more about yourself and a bit more about the Anthony Seddon Fund. So could you start by introducing yourself again and a bit more about the Anthony Seddon Fund and what you do on a day-to-day basis?
Yeah, of course. So as you say, I'm Ben. I'm the general manager at the Anthony Seddon Fund. So we're a peer support mental health charity based in Ashton-under-Lyne, Tameside. Suppose day to day, we do lots of different things to support people with their mental health and well-being. We have drop-ins, meditation, Reiki, different art groups, well-being groups, that kind of stuff. Our aims are basically, I'll try and remember these talking to Paul. The official line, number one. I've been revising. So we've got three aims, essentially, is to provide a safe space for people to be able to come and talk about their mental health and well-being, whether that's in depth, whether it's just your sort of general well-being, day-to-day kind of stuff that comes up, to influence service provisions. So we see a lot of people every day with different stories going through different challenges within mental health systems. So we like to make sure that they're having their voices heard in the right places where it can actually affect change in systems.
Yeah.
So not just reacting to situations, trying to be a bit more proactive around things. And then to work with other organisations to support us in reaching them aims. We're really good at that sort of, like, say, peer support with mental health, but when it comes to drug and alcohol issues or housing, finances and stuff, it's really important to work alongside some of the other great organisations within Tameside to achieve that. And places like yourself, helping us to get our message out there, and, which is really important. We all have different reaches within different sort of sectors, so it's good to do this kind of thing.
Excellent. Thank you very much. How did the Anthony Seddon Fund come about?
So Anthony, who the charity was named after. So Anthony was my brother. At the age of 18, he was diagnosed with bipolar. Spent a lot of time in and out of hospital. Usually more manic than lows. There's some stories there, but I'm not sure. I've already been warned not to swear. So, but yeah, in and out of hospital quite a lot. Struggled to stay well. He was on medication, which helped him, but in other ways that also just took away his personality and stuff. So he'd stop taking his medication, but then end up poorly again. So at the age of 30, he did take his own life. So from that, my mum in particular struggled to find that immediate support. Went to various organisations, and it's shifting now, but there was kind of a line of, with bereavement, you've just got to wait 12 months, 2 years, whatever it might have been, to get that. And it's like, I don't want to wait that long. I just want to talk about it now.
Yeah.
Don't necessarily need therapy or counselling. I just want to be able to talk about what's happened and what's going on. So struggled to do that. And alongside that as well, when Anthony did pass, we had lots of his friends coming up to us saying, we always thought Anthony was a little bit, strange, bit mad, but we just thought it was teenage stuff kind of, but there was always something a little bit different. So we decided we wanted to raise some money for Mind, Tameside, Oldham and Glossop Mind. So we did that by selling second-hand goods on the market, Tameside Market, Ashton Market. Raised over £10,000 for them.
Great.
With the aim of them going into the local secondary schools to deliver presentations, awareness workshops on what is mental health, how might it look physically, how might you feel, and just to raise that awareness. But yeah, that then went from that to people stopping and spending hours talking to us on the stall about their issues. Lots of people who knew Anthony from the ward, being up on the mental health ward. Lots of people going through bereavement and stuff, and in particular suicide bereavement, and not having any support around that. So we ended up opening a shop, which had a little bit of a space in the back, just really tiny space. But if anyone wanted to come in and just have a brew and just talk to us, they could. And it's just grown and grown. We opened up a centre, and I think we're in our 4th building, maybe. Just grown and grown. So that's how it all started, really. It's just snowballed from there. But yeah, lots of family involved. I've been there full time now for 2018, I think it was. But before that, I was working in a school, so doing voluntary work for them where I could, at the markets and stuff. I owed that over my brother. My brother's my boss. But I like to show him that I was on the market stall at 7 a.m. He's got the better job now, but I put in the hard work.
Excellent, great.
A bit like Red Rock, that with Cold Bite.
Oh, excellent. So, working, like you said, in Tameside and Glossop, and we're a Tameside business as well. We do a lot of work in the community, and we've started to see the results from our outreach of actually being more involved.
Yeah.
How's the support kind of grown with your work when you started working with the community more?
It's brilliant. I was saying to Paul again before, and that's one side of the charity we sometimes struggle with, is the
self-promotion.
The self-promotion, in a way, yeah. We find that a bit difficult, and it's a certain skill set, I think, in doing it. But we're certainly not against it. But I think it's a lot easier when organisations like yourself approach us or are more open to and do things like this. Invite us on to something like this. It makes it really easy then to have that. It's more of a two-way as opposed to us sort of maybe approaching them and us feeling like we're having to, I don't know,
sell yourself into conversation.
Yeah.
Natural.
And we struggle with that in terms of funding, just as from a charity sort of basis, really, trying to sell ourselves. It's we do what we do. We think we're good at what we do. Always rooms for improvement and learning new things as times change. But yeah, we just kind of got on with it. I think because of how we did start, and it just kind of snowballed. We've had no option other to just go along with it. But yeah, I think coming back to your question, just working with organisations like yourselves is great because you get to meet new people, you get to promote yourselves in different ways, you get to learn things from your side. I sat listening to some of your technicians, I learned a few things. I've forgotten them again since, but learned where the good chippies were near your office. I think that was one of them. But yeah, and it's good. It's good, but it also gives us an opportunity to speak about mental health and well-being, long-term mental health illnesses, suicide prevention to organisations that might not previously have thought about it or have, but they're in sort of different in different settings, aren't they, and stuff. So it's not at the forefront, obviously.
Yeah.
So it's good to be able to sort of educate or just open up people's thoughts around it and stuff.
Yeah, 100%. And I know mental health from me coming into Red Rock, when I was introduced to the team, mental health was a big topic, and it was an open door policy with Paul, James, and Sarah as well. And I think within businesses, sometimes it can get overlooked, not even just charities, but businesses and organization and kind of gets overlooked. You never know what's going on behind closed doors. And I can kind of imagine like the people that go walking through your door, the stories they have, you probably wouldn't tell firsthand until they start to open up. So like from the people coming in, what kind of like stories have you seen and how the organization helped them kind of come over those challenges and hurdles?
So it's a good question, that. I wish you'd written it down.
Sorry,
No, I'm joking. I'm joking. It's a good question. So I think make it quite a bit short, because I could go on forever, because we have a drop-in 1 till 3.
Nice.
So, and that is an open drop-in. So anyone aged 18 can come in, whether they have a diagnosis of a mental health condition, whether they've been bereaved, whether it's just, I don't know, they've just split up with a girlfriend or husband or something like that. So the breadth of people we see and the range of issues going on is massive. So a day-to-day for us can be, really different, but we get quite a lot of people from out of Tameside come to us as well. So particularly within the NHS and stuff, because I think there's still a stigma from even within the NHS sometimes around mental health, and there's lots of pressure on those systems anyway, isn't there? So people sometimes feel like they can't talk out, or they want to just speak to a stranger. And sometimes I think there's still a stigma around peer support. You hear peer support, and a lot of the time we get that first. People have been referred to us by a GP, and they'll ring us up and we'll go, "Oh, we're peer support," and like, does that mean I have to talk to people?
Someone,
walk into a room kind of thing.
Yeah,
and it's like, you do, but come and see, because it's not as bad as you think. Sometimes you can just sit and have a brew and talk about what you want, and that's the beauty of peer support. Is we're not trying to assess you, we're not trying to sort of be clinicians or even solve your issues for you. We're just trying to give you an opportunity to be able to talk about, get it off your chest. And if we can give you a little bit of guidance on how best to sort of make your way through those issues, then that's great. But bereavement, people with schizophrenia, bipolar, suicidal ideation, self-harm, lots of issues really. But it's thingy. But going back to your point, I think it's important to pick up, because I'd like to acknowledge. So when I went to your office before the Tameside Business Awards, did notice things around the office. Take note on things like that sometimes, because I like to see if
observant.
But what did stand out to me is in particular the wheel. You've got the prize wheel, and then there was a wall of your aspirations, I think, and things like that. And I just thought that's really good. It's good that you're promoting that and providing a welcoming environment for people to be able to share their aspirations and not have to. Sometimes you're in places that are competitive, aren't they? You're made to hide them sometimes, or like you say, have those conversations behind closed doors, which sometimes create sort of not a togetherness. So it was nice to see at Red Rock.
We tried to when we settled Red Rock, it was one of the things we wanted to push, sort of thing, in that side, not just be a business that you come and you do your work and go home and that's it. Be a good place to work, and just try and be open as much as possible.
It's I'm no statistician, and I'll do some reading about mental health and statistics and all that stuff, but it's crazy the amount of numbers that you're talking about monetary wise, where people are off for mental health reasons, whether it is work stress or other mental health related, millions and billions of pounds and stuff. And it really needs to have a shift towards let's do more for staff's well-being and less pressure on them. And that actually, even if you are just talking money, not for the human side of it kind of thing, so monetary values, the amount of money people would save is
it's also just the right thing to do.
Yeah, that's what I mean. It should come down to just being the right thing to do. Definitely. Yeah, it really should. I've worked in places where you don't feel happy, or you're stressed. it's not a nice feeling, and you ultimately end up passing that on to other people. And
easily.
It's and that's, I think, what's so great about the Anthony Seddon Fund is, yes, we are a mental health charity, but just that feel around the place, I think it helps having a few family members there, but it's become a massive, it's an extension of our own family.
Yeah.
The volunteers, the staff and stuff, they're always there to support each other. And if they've got stresses going on in life, don't worry about it. We'll step in and support you. So,
100%, and it's key. And I like the fact that you don't just, seclude yourself to tame side or gossip people and individuals and organizations. Anyone that needs the service, it's welcome for them to take.
Definitely.
Which is great.
Yeah, it's really important that to us. That's, we have those aims, the official aims, but for us, it is just, if someone turns up at your door and they need to talk, let them in.
Yeah.
And even young people, we have young people turning up, and they obviously can't come into the drop-ins and stuff because you've got safeguarding issues there with being 18 plus and things. But we'll always take them to a private room, have a chat with them about where they can go, and talk through their options, not just go, we're not the right place for you, you need to go there, and send them on the way. Giving them the opportunity to talk, and the parents or whoever's come with them maybe. So yeah, it's hard work sometimes. It can be stressful because you don't know what the day-to-day is going to bring, especially with the drop-in. These days where we'll see people who come in every day, and then they might have a quiet day, and then there's, I think, a couple of last Friday they had 40-odd people in.
Oh wow!
In that 2 hour, and they were all in together. We have a quiz on a Friday, so it is a little bit busier, but that comes with issues as well. But, 40 people, and only a couple of members of staff, and the volunteers are great. So
excellent. So yeah, I was gonna ask a question to Paul. Actually, I know from your side of things, you've got more of an extensive relationship with Ben. How's that relationship with Red Rock? Working with the Anthony Seddon Fund, and I'm sure what we'll get into strengthens that collaboration a bit more. But how have you found that partnership, and what kind of things have you learned from the Anthony Seddon Fund that you've kind of tried to apply into Red Rock?
Wow.
I know I'm asking I'm asking questions that are not on the sheet, but yeah.
Do you want to say that one?
Okay.
I'll word you tomorrow morning. Get back to it. I'll get my own back. I think we talked about it a little bit in terms of with this one, so we haven't got to why we're doing this at the moment. But we're just trying to, as a business, work with as many local organisations as possible and charities.
Yeah.
Because it's important to us, and it's trying to find. I think the most frustrating thing I find is you always want to do more, and you're a growing business. There's only a limited amount of resources, like any business. Well, there's a limited amount of resources, time, money, whatever you want to call it. So it's trying to find ways of just helping as much as possible. Because I know we mentioned some other charities before in the same side area that might have better fundraising machines, for want of a better phrase. So for me, I think it's just, I get frustrated that from my perspective, we don't do enough. Whether that comes across like that, I don't know. Or things take longer than you think they're going to take.
Yeah.
Or you want to do more, or you think you'll do something that doesn't really get off the ground. So for me, I don't know. It's just try to find ways. When we had the meeting a couple of months ago, when we started to discuss this, it's annoying because I can't mention what it is.
Give it 10 minutes.
I just try to find ways of, two things really. I know you put a question like, what's the ultimate goals? I'm going to jump ahead there. It's like, how can we help you raise money and promote your service and what you do? That's it. That's the bottom line, really. There's those two things.
Yeah.
So it's, for me, the relationships, whoever it's with, whatever charity or organisation, it's just about those two things. And it's trying to figure out ways of doing those.
Yeah, and I think from our perspective as well, it's important when we're spending charity money as well that people have worked hard to raise, and giving up their money, that we're spending it correctly as well. So working with organisations like yourself, it's not just about the sort of what can we get from you in terms of money.
Yeah.
In fact, I think that's a bit of a misconception a lot of the time is when charities approach people is they just have the money.
Yeah.
A lot of the time, you're never going to turn down money, obviously, but a lot of the time it's resources or having someone who, so for instance, our building is quite big and none of us are IT technicians or networking, and, so it's good to be able to have someone who you can phone up and just, would you mind just helping that? And they're not charging you 250 quid an hour to do so or something. So that saves the charity money and time itself. So just those resources are really good. And from our perspective, again, I think I'm not too sure. I can only talk from obviously my own perspective as well, I suppose. Is your charity and business kind of different? Sorry.
No worries. Yeah.
But charities have got to be run like businesses.
Yeah.
We employ people, we pay national insurance.
You've got to keep the lights on.
And that is the only difference is that profit goes into going back into putting things on for people, but we still have to sort of make money, pay the bills and things like that. So it's good to have relationships with businesses as well, because you can pick up little hints of sort of support there or what to do best or but it's good, it's important, and it's just the beginning as well.
It's still
we've not known each other too long, so it's exciting what we've done already. It's exciting what we've got planned, but we can't mention.
Don't worry, 5 minutes and then I'm sure everyone's waiting is like, what are they trying to hide? Like, should have just skipped 5 minutes. Like, we'll get to it. But I think it is important and stuff that we've done and looking to do, not just this year, but really trying to continue that relationship, watch it blossom. It's important that businesses can hopefully see that and emulate it, whether it's in Tameside or wherever they are. Talking about projects, before we get to our projects, I know we spoke downstairs about the Baton of Hope campaign that you're running. I just wanted to touch a bit more about that, just to let people know, because people might be thinking, how could I support? Maybe I'm not in those shoes, but how can I potentially come and support? Could you tell the audience a bit more about
definitely.
that?
So one thing we've got coming this year, it's called the Baton of Hope. So the Baton of Hope itself is its own charity. It was set up, I think, in 2023, I think it was. And it is literally a baton. Looks a bit like the Olympic flame from 2012, kind of. And it's a symbol of hope, suicide awareness, suicide prevention, set up by two bereaved fathers who just wanted to do something again to raise awareness around suicide prevention. Again, no statistician, so I can't reel the numbers off you, but I think at the moment, I think the age range is slightly different, but I think it is the biggest killer in men under 40. So when you take that into consideration with cancers and heart issues and things like that, and those can be preventable. So the Baton of Hope 2023 did a tour around 12 cities. You could apply to be a baton bearer. So I went along to Manchester, did it there, and it was great. You got to meet loads of other people who've been bereaved by suicide. It sounds odd when I'm saying it was great, but, but it was nice to meet other people who've been through similar experiences, to hear their experiences. Other organisations were there, so lots of suicide prevention charities, mental health charities were taking part of it as well. And just to bring some awareness around it and trying to break that stigma, because there is still a huge stigma to talk about your mental health. So they're doing a tour this year, 2025, 22 cities I think they're visiting, towns, cities, and we applied to bring one to Tameside, and thankfully they said I regretted it as soon as I sent it. But no, so really excited. So we've got it on Friday the 12th of September. So the baton will be coming to us. Lots of exciting initial plans, trying to find the good landmarks in Tameside, which there are. It'll be good to sort of visit them and showcase them. got lots of organisations involved already. I was just saying before as well, hopefully getting young people involved, schools.
Yeah.
So yeah, exciting times ahead for that. We've got the route planned, I think, but we're just trying to get the permissions from
council.
Yeah, you have to submit your risk assessments and stuff. But that's really hard to do when we don't quite know how many people are going to be there at the minute, because it's not till September. So I'm trying to get it booked before
you know,
and then I'll be able to. But yeah, and then once that route's done, we'll be able to get other organisations involved, and we're hoping to have activities on throughout Tameside as part of it. So
nice.
People coming from outside of the area, they've got something to do all day. If they want to come all day, if they're not doing the walk till the afternoon, there'll be stuff on in the morning that they can go and take part in. And then hopefully finishing off with a bit more of a positive note, hopefully a bit of live music, live performances, we're hoping. But yeah, so people can get involved with that lots of different ways. Money. We're going to have to raise some funds for it to put it on. Not a lot, hopefully, because again, there's many organisations and stuff we're willing to provide things for free, resources. So there will be stuff we need, whether it is local supermarkets giving us bottles of water that we can give out on the day, or a business construction company lending us the high-vis jackets we can use to marshal people, volunteers for the day. Yeah, lots. But then also, I think for the Anthony Seddon Fund, probably should mention, I'll get in trouble if I don't, we're always looking for volunteers. So you don't have to have a mental health diagnosis condition. You just have to be able to listen and want to support people. And if you have got that lived experience, great, because that helps people, talking, sharing your experiences with people really helps. But lots of roles there, whether it is you just want to help make the brews, or you want to do some peer support, or help us with cleaning, whatever it might be, networking, going out doing the market stalls for us when we're there. So, but yeah.
Excellent. Yeah. That's fine. And I'm sure all the information, they can follow you on social media sites or pop in.
That's why you're here, Stephen.
Yeah, it'll be down in the description.
Yeah, so go on our website, www.tasfund.org.uk. Yeah, and there's loads of information on us as a charity, and also we've set up some pages around the Baton of Hope as well, and how to get involved and stuff.
Excellent. Thank you very much for that, Ben.